Good evening medicals, welcome to Medical Students Corner, myself Dr. Krishneswari. Today I am here to introduce a new session on our channel. Many of the young doctors suggested me to start a session on interpretation of lab investigations so that it will be easy for them to treat the patients, to see the lab investigations, to interpret the results in their clinics. So, our channel is planning to start a new session on interpretation of lab investigation. So, I will say the schedule of our channel once more, which is rearranged from today, so that there will be 4 sessions every week. So, Sunday there will be a session on ECG. Tuesday there will be a session on Malayalam, so that it will be beneficial to common people also. Then Thursday there will be a session on interpretation of lab investigation. Saturday there will be a session on symptomatology. And so there are 4 sessions. So this is the way our sessions in the channel is rescheduled. So hoping for your support. If you are having any suggestions, please let me know. We will rearrange again. If you are having any suggestions, if you need any special classes, or if you need special investigations, or something related to some disease conditions or what, please let me know. Hoping for your support. I think you will be happy with these sessions. If you are unhappy, if you are having any suggestions, please let me know. So today is Thursday, and today we will start the interpretation of lab investigations. We will be saying only the important investigations which we are frequently seeing in our clinics. We are not going to all the investigations. Maximum we will cover. Maximum investigations that we will be getting frequently, our channel will be covering. And if you are having any suggestions, if you are having any additions, you can say. No problem. Okay, awaiting your suggestions. We are very happy to receive your suggestions. So today we will start with HbA1c. One more thing, we will not be having so much of discussion on a particular investigation. We will be completing within short time, so that we will be saying only the points which is necessary for you to interpret a lab investigation to come to a conclusion. Okay, so today we will start with HbA1c. HbA1c, everybody knows it is glycated hemoglobin, is it not? Glycated hemoglobin, HbA1c. Glycated hemoglobin. It is also known as glycosylated hemoglobin. So we will be discussing what is HbA1c, what causes increase in HbA1c, what are the normal values of HbA1c, and what is the misinterpretation, where we will be getting misinterpretation of HbA1c. So we will be having short small discussion which will be very crisp, and which will be very easy to understand, and which will fit in your memory. Okay, so HbA1c, it is also known as glycated or glycosylated hemoglobin. So what is the mechanism behind increase in HbA1c? So when there is increase in plasma glucose, so in diabetes mellitus there will be increase in plasma glucose. So what happens is, when there is increase in plasma glucose, there will be increase in non-enzymatic glycation of hemoglobin. Non-enzymatic glycation of hemoglobin. So normally there is enzymatic glycation of hemoglobin. So when there is increase in plasma glucose rather than beyond normal level, so what happens is there will be increase in non-enzymatic glycation of hemoglobin. So what happens is there will be increase in HbA1c. HbA1c, which is a factor of what? Non-glycated hemoglobin, HbA0. Okay, HbA0. HbA0. So adult hemoglobin is HbA, we all know, is it not? So the adult hemoglobin, the non-glycated form is HbA0 and non-enzymatic glycated form is HbA1. So what happens when there is diabetes mellitus? There will be increase in non-enzymatic glycated hemoglobin, which is HbA1. So when we look for HbA1c, we can come to a conclusion that person is diabetic or not. You understand? This is the mechanism by which the glycated hemoglobin or HbA1c is increased in diabetes mellitus. So this HbA1c, it show the glycemic index, that is glycemic index of hemoglobin or glycated hemoglobin within 2 to 3 months, before 2 to 3 months. Since the, why like that? Since the life period of RBC is 120 days, HbA1c represent the glycemic index or glycemic intake of hemoglobin before 3 months or 2 to 3 months. So when we should check what are the interval we should check HbA1c, we should check normally if the patient is having good glycemic control, we should check once in 6 months. With good glycemic control, we should check within 6 months, once in 6 months. And if the patient is having a poor glycemic control, then we should check the HbA1c once in 3 months. Okay, so that will be coming to a conclusion whether the patient is diabetic, whether the patient is improving by treatment or whether the patient is deteriorating by treatment. You understand? So what is the normal level of HbA1c? So according to WHO, so we will be saying the standard values. Okay, according to WHO, if the HbA1c is 6.5, greater than 6.5, %, then the patient is diabetic, and 6.5 is considered as the cut point to diagnose whether the patient is diabetic or non-diabetic. Okay, but according to Davidson, the normal range of HbA1c is 4 to 6%. According to Davidson, it is 4 to 6%. And according to some other text and some other articles, it is said that when the HbA1c is between 4 and 5.7, between 4 and 5.7, then the patient is non-diabetic. If the HbA1c is between 5.6 to 5.8 to 6.4, then the patient is pre-diabetic, and if the HbA1c is 6.5 or above, then the patient is diabetic. You understand? So we can conclude that if the HbA1c is above 6.5, then the patient is diabetic. If it is between 4 to 6, non-diabetic, and between 6 and 6.5, it is pre-diabetic. So this is about HbA1c. So next, where we will be interpreting when there will be misinterpretation of this HbA1c. So if the patient is diabetic and we are checking HbA1c, but HbA1c is normal and we are misinterpreting it as the patient is non-diabetic. So what are those conditions? So first one, when there is increased destruction of RBCs, that is hemolytic anemia. 1. 2. When there is anemia, hemolytic anemia. 3. Uremia, when the patient is suffering from uremia. 4. When the patient is pregnant. Okay, so these are, and when the patient is having hemoglobinopathy, some disease in relation to RBCs, some disease in relation to hemoglobin, uremia, and also pregnancy. So these are the conditions where we will go for misinterpretation of HbA1c. So by this we are concluding the session on HbA1c. Hoping that it is an useful session. You got a brief idea about HbA1c, which is very essential for confirming whether the patient is diabetic or not. Okay, so we will be having Thursday these sessions. Okay, like this we will be having interpretation of lab investigations, important investigations. So hoping for your support. If you are having any suggestions, any doubt, please let me know. Please subscribe, share. Happy learning. Thank you so much.